impacting your heart and circulation. An urgent conversation. Heart disease is the #1 cause of death worldwide, and here in the Bahamas, coronary artery disease and peripheral arterial disease are silent threats that too often go undetected until it's too late. What exactly is coronary and peripheral arterial disease? What puts us at risk? And what can we do to protect ourselves and our families? Today, Dr. Charles Lucas and Dr. Eliaz share vital answers that could save lives.
My name is Dr. Eliaz, and I'm an interventional cardiologist. I perform coronary artery procedures, and we'll speak about that.
Okay.
Hi, my name is Charles Lucas. I am a general vascular endovascular surgeon. I work in the blood vessels in the body.
So we're going to start with a few basic questions so that everybody understands what are the two areas that you focus on. And the first one is for Dr. Eliaz. What is coronary artery disease?
So basically, the coronary arteries are the same arteries that supply blood to the heart muscle. Heart's a muscle, it needs a lot of oxygen and it needs the blood supply to function. And the coronary arteries are the large arteries that sit on the heart and they supply the heart with oxygen while it works. Now, when there's a problem with coronary blood flow in those same arteries, that's when we have conditions that are called heart attacks, for example.
So, Dr. Lucas, what is peripheral artery disease? How does that differ from coronary artery disease?
Peripheral artery disease refers to narrowing or blockages in the arteries, and these are the blood vessels that take blood from the heart to the legs. So primarily, these blockages will result in decreased nutrients and oxygen getting to the legs.
Okay, well, that makes it fairly simple. So heart versus lower limbs, legs, and other arteries. Okay.
Correct. Yes.
So, Dr. Eliaz, what causes coronary artery disease?
Well, that's a great question. So there are a lot of causes. Now, the basic root or the basic process that happens in arteries starts from pretty much day one when we are born. Usually there's a buildup of materials like immune cells, calcium, cholesterol depositions, and other fibrous tissue that leads to narrowing of the vessel wall. And that process is called atherosclerosis.
Okay.
That happens in the heart and coronary arteries, as we mentioned. And over time, that might lead to blockages and reduced blood supply to the heart. That will lead to symptoms eventually of shortness of breath, chest pain, and many other symptoms that need to be recognized if that disease process continues.
Okay, so Dr. Lucas, are the causes similar for peripheral artery disease, or are they any different?
Correct. The risk factors are pretty much the same. We talk especially in the Bahamian population. Apart from increasing age, we know it's more common as you get older, as Dr. Elias spoke about. But hypertension, diabetes, and high cholesterol are big in our population.
Yes.
And these are some of the biggest risk factors that we've identified in the Bahamian population.
Okay. Do either one of you know the extent of coronary artery disease in our population? Like, how big is it? I know a lot of people with high blood pressure and a lot of people with diabetes.
Well, that's a great question. Unfortunately, we have a high incidence of coronary artery disease as well as peripheral artery disease. Unfortunately, a lot of people don't come forward with their symptoms, and sometimes, unfortunately, they're identified too late.
Okay.
And we've had people who've passed, and I know Ron has dealt with so many who have undiagnosed coronary artery disease.
Wow.
And I know in my practice, we see a lot of underdiagnosed peripheral artery disease. So it's a really huge problem, and that's why we're trying to put a spotlight on it. And thank you for having this interview where we can educate the public and let them know how serious it is.
So you're saying that there are people who actually walk around with these conditions and have no clue? Is it that they are missing symptoms that they have that they're not aware of?
True.
What are some of these symptoms that they may experience and not realize what's happening?
True. I just to strengthen what Charles just said, a lot of these cases are misdiagnosed and undiagnosed. A lot of these young people, sometimes they walk around with this disease occurring, and the symptoms of, for example, chest pain that is brought by physical exertion, sometimes very moderate type of exercise like climbing stairs. They might get a little bit of chest pain. They might kind of brush it away saying, oh, I'm not out of shape or whatnot. But the typical signs and symptoms are many times just overlooked and missed by healthcare professionals. So
Right.
the typical ones would be shortness of breath and chest pain. Those what pretty much everyone is teaching today. But the very atypical symptoms might be some right or left arm pain, some pain in the jaw that radiates, sometimes cold sweat, sometimes shortness of breath, dizziness upon doing sometimes even minimal exertion. Those signs and symptoms are overlooked, and they might be signs and symptoms of severe blockages in the arteries.
Okay, so Dr. Lucas, how does it put our feet at risk?
Okay. So what we found out, or what we realized, is that 75% of patients have no symptoms, but they have peripheral arterial disease. And the subtle signs may be just decreased activity levels. We then find people with more severe disease may complain of pain in the calves, sometimes in the thighs, sometimes in the buttocks. They can even present weirdly with erectile dysfunction and other problems. And so there needs to be a high index of suspicion. That is, you need to see your healthcare professional for any issue with the legs so you can be properly diagnosed and so you don't have your problem missed. We also can see patients presenting, especially our diabetic patients, with wounds that don't heal as well as infections.
Okay.
And in the extreme cases, toes or even the whole leg may be dead and may necessitate basically amputation, which we are trying to avoid with patient education and early awareness.
What about, I've heard of something called angina. What does that mean?
Yeah, so angina is kind of it's a medical term, but over the years people tend to use it to describe any chest pain pretty much. But angina relates specifically to that type of chest pain that arises when there is some restriction to blood flow to the heart. The typical angina, that means the typical symptom of an angina, are that same pressure that some patients feel in the chest. It might be the upper abdomen. It might radiate to the left shoulder or the jaw, sometimes with some sweating that comes with it. But those typical anginal symptoms are missing in a lot of patients that we see. And that's the main point today. Everyone talks about angina, but the problem is that many patients will come in with totally different symptoms and not the classical angina.
Okay, so persons with peripheral arterial disease, you mentioned some of the things that may be happening. Is tingling, is that something that could possibly be associated with?
Definitely. So patients may present or complain of tingling in the feet. They may say that their feet feel a bit cold. They may complain of a tightness. So there are myriad of symptoms that patients may complain of. And they need to have a pretty high index of suspicion. They need to be checked out if you have any persistent symptoms, any troubling symptoms with your feet. Please seek help. As we talked about with peripheral arterial disease, even in patients who have mild symptoms or no symptoms at all, they're at increased risk of heart attack, stroke, and death. And that's what we're really trying to present. And hopefully we can talk a little bit about that link between peripheral arterial disease.
In fact, I was going to ask you, what is the link between peripheral artery disease and heart attacks or coronary artery disease?
Yeah, I guess that's the main question, because the link is a very strong link. Obviously, the same disease process that goes on in the legs is a here bear or a mirror image of what's going on in the heart and any other artery in the body, for example. So patients who have a lot of pain in their calves, a lot of symptoms in their lower limbs are at very, very high risk to develop these same blockages in the heart. Might have angina, they might overlook it, they might have just shortness of breath and thinking, oh, it might be just me being out of shape. But the link is very, very strong. So the percentages are very, very high for people who have established peripheral vascular disease. To have coronary heart disease going with it together, they're many, many fold at risk.
And so it's so important. You may think you just pulled a muscle or have difficulty walking far, which is a classic symptom of peripheral arterial disease, but you're actually at 6 times higher risk of developing a heart attack and even dying, and a significantly increased risk of having a stroke and dying or having severe disability from that. So the link is strong, and that's why we are joining forces, hopefully, to spread the word about peripheral arterial disease and coronary artery disease. The blockages that happen around the heart can also happen to the blood vessels that supply the brain and other organs in the body. And so we recognize that even though you may have a problem in your hands and your feet, this may be a significant problem and increases your risk of having problems in the heart and elsewhere.
Right. So based on what I understand, persons obviously are more predisposed to these conditions than others. Again, we mentioned high blood pressure, we mentioned diabetes. Are those people specifically more prone toward those conditions?
Yes. Okay. By many, many folds.
So then it means that people who have those conditions possibly do, if they manage or monitor them, they would have a lower chance. I mean, that would lessen the chance.
And specifically for patients who have peripheral arterial disease and trying to identify them early, because we talked about so many are just asymptomatic, they don't have any symptoms.
Right.
We recommend if you're above the age of 65, you should be seen by a vascular surgeon or other specialist to check for the disease. If you have hypertension, diabetes, and these other risk factors, you may want to begin that screening or seeing a doctor specifically for that risk earlier, about 50, 55. And if you've had a stroke in the past, heart attack in the past, then definitely need to be followed up and make sure that you don't have this blockage happening in other areas like your legs, etc. And one other thing is, if you have a strong family history, you need to come forward and make sure that you identify your risk factors for peripheral arterial disease and coronary artery disease, but have your annuals and keep checking up every year.
Okay.
That's right. Just to emphasize what Dr. Lucas just said, I think it's very important to understand that there are many other risk factors that play a role, and not just the mainstream hypertension, diabetics, which a large part of the population suffers from, but also obesity and family history that people overlook and they're not aware of. So when me and Dr. Lucas see patients in the clinic, we don't just ask them. I ask about symptoms in the legs. Dr. Lucas asks about chest pain. So that's the interconnection. But not only that, we ask about family history. So we ask, did anyone in the family suffer from sudden death, God forbid, at a young age, or anyone had any heart disease? Many patients won't know how to answer that. You say, yes, my mom had something with the heart, my dad had something with the heart. The next question will follow is, what age do you think they started having these problems? Usually if they say before the age of 50, then we have a problem. And that's early onset. That means that this type of population needs to have special type of attention right now to actively search for problems.
Right. So once you discover that you have an issue with either coronary artery disease or peripheral artery disease, is there any treatment? Can it be treated?
Oh, yes. There's a lot that can be done, of course. Well, first of all, it's early detection that we are talking about. We're talking about prevention. We're not, for me as a physician, Dr. Lucas, I guess, shares the same thing, is having a patient coming in for a procedure to save his limb or to open up a blocked artery in the heart. That's late. We don't want to meet the patients there. We want to meet the patients happy and smiling. We don't want to meet them in very unfortunate situations if they even reach it to the hospital.
Mm-hmm.
So yes, there's a lot that could be done. First of all, it starts with prevention. Second of all, there are medications, of course, treating the underlying diseases as hypertension, diabetes. We call that control, the disease itself, very important. But then again, even patients who have a risk factor, have family history of coronary artery disease, they're not aware of treatments that can be given to them or offered to them, as, for example, aspirin for primary prevention, or a statin, which is a medication that lowers blood cholesterol, for example, that could definitely improve their chances of halting and not progressing into heart events. Don't you agree?
Absolutely. And just to harp a little bit more about prevention, we know that our population, our people in the Bahamas and in the Caribbean, they don't like to take tablets. But good news, we can begin with exercise. And, for us, if you come in with problems with your legs, you're going to start with walking 3 to 4 times. We recommend at least 45 minutes, and it should be supervised. You should have a trainer or somebody with a little bit of medical background to really make sure that you're not just talking and having a good time, but actually working out and improving the circulation in the legs. But also too, as Dr. Eliaz talked about, these people also may have cardiac issues. So if you start to have some difficulties or problems, somebody who can quickly recognize it. And I know there are a lot of community groups and there are a lot of qualified trainers out there that can help us in this aspect. We want you to stop smoking for sure. That's a big no-no. We know that e-cigarettes and hookahs are popular now. We're going to tell you, please avoid it. Please don't do it. It's not good for your heart. It's not good for your legs. For those patients who have diabetes, talk to your doctor about the right treatment. And the hypertension, I know there were new guidelines telling us to get it even lower, to get better control, and that's going to prevent the peripheral arterial disease and the heart attack. And as one said, there are medications and there are treatment options. Thankfully, we're in the era where we can do this all minimally invasive, as with small needles and wires. We can open up the blockages, but we don't want to get there. We want to see you early. We want to prevent this from happening, and for our people to have a healthy and long life.
Right. Prevention is key.
It's key.
Okay.
Yes.
So you mentioned high blood pressure and lowering the numbers. What is the number now we should be trying to achieve?
Yeah, Julie, that's a great question, because they just came out with the new guidelines for treating hypertension. Well, they haven't changed a lot, but ideally the blood pressure should be kept below 130/80. So that's the recommended blood pressure, and hasn't changed significantly, but efforts are made to aggressively treat the blood pressure, because we do acknowledge it's a very, very heavy risk factors out of most of the risk factors, as well as diabetes. But more people suffer from hypertension today than any other numbers we've had in the past. Diabetes follows with a very mere difference. So those are two issues that need to be addressed.
Yeah, we know that 90% of patients with peripheral arterial disease have hypertension. And as Ronan's talking about, diabetes is going to increase your risk of having peripheral arterial disease, fourfold. And a special population is our end-stage renal disease patients who are hemodialysis. Even though they make up a small portion of the population, they're extremely high risk of developing peripheral arterial disease and coronary artery disease, and a rather aggressive form of it.
Well, we thank you so much for taking the time. I'm hoping that we could have another segment where possibly we could take questions from viewers about these two conditions that you may be able to come back another time and answer. But until then, we take your advice and we ask all who watch to listen closely and to follow the advice to prevent coronary artery disease and peripheral artery disease. And thank you so much again.
Thank you.
Thank you.
Coronary artery disease and peripheral arterial disease may be silent, but they are not unstoppable. With awareness, early detection, and lifestyle changes, we can reduce our risk of heart attacks, strokes, and limb loss. Talk to your doctor, take charge of your health, and remember, prevention is always better than cure. Brought to you by Nassau Agencies Limited, your quality assured pharmaceutical wholesaler.